Hello, I'm Robert McGowan, Vice President of the Metropolitan Water Reclamation District of Greater Chicago. Congressman Bobby Rush sends his regrets as he had a death in his family and could not make it today. So let's keep him and his family in our prayers. I want to take a little time to thank all of you for joining us, and many thanks to our participants for taking the time to share their thoughts about Black health and wellness today. In the interest of full disclosure, this session is being recorded and will be posted on the district's website, MWRD.org. So you can't go back and change what you say. And you can't speak another language, if you know what I mean. As we know, Black health and wellness not only includes one's physical body, but also emotional and mental health as well. We will now meet our esteemed guests to answer some questions related to today's theme. I think I'm going to start by asking each one of you to take 2 minutes to tell us a little bit about yourselves, including why you ran for elected office or work for non-for-profit organization. Let's start with our Chicago 29th Ward Alderman, Chris Taliaferro. Alderman Taliaferro, can you start us off, please? We can't hear him. I can't hear him.
Okay, we should be good now.
Okay, we good now. Good
Thank
morning.
you all. Thank you, Vice President McGowan. And let me say thank you for inviting me to join you on this panel. And my thanks goes out to our President Steele as well. And the esteemed panelists, I'm honored to be here with you. I am Christopher Taliaferro, Alderman of the 29th Ward and Chairman of the Committee on Public Safety. Just a little bit about myself. I am originally from the state of Virginia, served about 10 years in the military in the United States Marine Corps. And after that, I served as a deputy sheriff and then a Chicago police officer, where I retired after 23 years of service. I'm an attorney now, as well as an elected official in the 29th Ward in the city of Chicago, representing the constituents on the west side and the northwest side in Chicago City Council. I ran for office, Vice President, because I felt I could make a difference in bringing resources to our communities to help make lives better in many different aspects. And so I think that that was one of my primary goals and primary function, my primary focus for running. And it's been an honor to be able to do that for the residents of the ward.
All right, thank you.
Thank you.
Our next guest is Dr. Elizabeth Lockhart, Executive Director of Healing Temple Church of God. Dr. Lockhart? I see your lips moving, but I can't hear you.
Oh, sorry. Good afternoon. My name is Dr. Elizabeth Lockhart. I am the Executive Director for Healing Temple Church of God in Christ, and we're located at 4941 West on Chicago Avenue. And it's good to be here today. This organization started in 1977 by my father, the late Dr. Arthur Lockhart, who was a spiritual leader. But Dr. Lockhart felt like it was not enough just to give people spirituality. When he was in the community, he saw that there was a great need. There was poverty in the community, there was homelessness in the community, and there was also economic inequities in the community. So he decided to come outside of the church and began to do other work in the community, such as youth intervention, work with our veterans on suicide prevention, work with our seniors on health and wellness, and also to start a food pantry because he wanted to make sure that no one went to bed hungry. So we are here in the West Side doing a great work, working with the community and bringing hope where there is no hope. Thank you.
Thank you, Dr. Lockhart. Let's hear from our president of the Water Reclamation District, Carrie Steele.
Hello, everyone. How are you? First, thank you, Vice President McGowan, for putting this together and for, inviting us all to attend this Zoom meeting. As stated, my name is Carrie Steele, and I'm president at the Board of Commissioners, for the Board of Commissioners at Water Rec, but I became involved in politics. It's kind of simple. It sounds like Alderman Taliaferro, what he said. I saw something in my community that I felt I could change, or I felt I could contribute to make a positive change in our community. And I stepped out there and decided to run for office. I've been around politics for most of my life, and I was involved in the community for most of my life. And as probably 20 something, Carrie said she would never go into politics. But as I got older and remained involved in my community, I couldn't just sit back and not do anything and not be a part of the positive change I wanted to see in my community. So that's the short version of why I got involved in politics.
Thank you, President Steele. Commissioner Kimberly Buclet.
Good afternoon, everybody. And again, thank you, Commissioner Vice President McGowan, for hosting this panel. And I'm honored to be here with my fellow commissioners in front of the community. So I was happily working at the Park District when I saw that a former president had been elected. And when he was elected, he started to roll back environmental protections that had been in place for decades under both Republican and Democratic administrations. So it really wasn't political. It was just something he wanted to do. And having had a previous experience in the General Assembly working with environmental groups, I wondered where I could jump in to make a difference in the environment and trying to preserve our fresh water and our fresh air. Although, as we all know, MWRD has very little to do with fresh air, but the environment in general. And the one opportunity I saw where I could make a difference was to run for MWRD. And so I jumped into the race because I wanted to make a difference in trying to help clean up our water, help keep our fresh water supply clean, and understand what I could do as an individual and us as an organization to preserve our environment.
Thank you, Commissioner Buclet. Commissioner Shekinah Perry.
Thank you, Vice President, and happy Black History Month, everyone. I'm Shekinah Perry. I grew up on the South Side of Chicago in the back of the yards and Ashburn communities. Currently live in the Southwest suburbs in Justice, and I decided to get involved with this work because as a person who loves civic engagement, who loves voting rights work, I often see that poor and working class people are often left out of our democracy. So when I look at government agencies like MWRD, in addition to environmental justice, I think it's a perfect way to get more everyday folks involved with government work to provide them with resources to help improve their lives, and we can meet them where they are in their community. So I'm just really happy to be here today.
Thank you, Commissioner Perry. We're going to move on to our next question. And remember, you have 2 minutes to respond to each question. Beverly Sanders, our Director of Human Resources, is going to serve as our timekeeper. So when you hear this sound, we're waiting on the sound. Did everybody hear that? Oh, well, then that means your 2 minutes are up. Okay, some African Americans have a mistrust of the healthcare system in general due to historical mistreatment. An example is the Tuskegee study, in which African American men were led to believe they were being treated for syphilis, when in fact, the researchers were letting the disease take its course. Another historical example is the use of Henrietta Lacks body cells, mass-produced, for research and millions in profits without consent or financial restitution to the family. This mistrust extends to mental health, as well as mental health in the African American community has also been impacted by racism, poverty, stigma, lack of information or availability of services, incarceration, and trauma. The COVID-19 pandemic has negatively impacted mental health in many ways due to the isolation, fear of the disease, and lack of available resources and services. There are lessons that can be learned from the response to the pandemic as it relates to mental health and other resources. Remember, you each have 2 minutes. I'd like us to give your thoughts, starting with Dr. Lockhart, then President Steele, Commissioner Buclet, Commissioner Perry, and Alderman Taliaferro. Dr. Lockhart.
I'm always keeping myself on mute. Thank you, Commissioner. As it relates to that particular question, you know that the pandemic has changed quite a few people. It's made quite a big impact. And I think one of the things that it has done in reference to us being in the community is that it has brought us a different kind of awareness. The things where we were not aware of prior, it has enlightened our awareness of what it is that we need to do to protect not only ourselves, but to protect those that are around us, those that are in our community. I have seen from working with our seniors, what it has caused with isolation, and it has been very devastating in that respect. It has affected the mental health of a lot of our seniors. A lot of them that went into the pandemic ended up having dementia because of their isolation. So it does not just affect isolation with their mental, but it affects children as well, but on a different level, a different type of mental effect that the pandemic has done. So thank you.
Thank you, Dr. Lockhart. I want to ask another question here based on some of the things you said, because you did mention the children. What kind of effect, and the rest of you can tag this question on when you get the answer, if you like. I've been told that I'm not part of the panel, so I can't talk a lot. But I do want to follow up with the effects that the pandemic would have on our children, especially our younger children.
Are you asking me that, Commissioner?
Yes, ma'am.
Okay, so you know, it's just like a baby. When a baby is born, it is known that if you take a baby away from its mother in its first few days, that the baby will die from affection and from attention. Well, when children are growing up, especially in different age bracket, it is important for them to be able to develop their social and emotional skills. And those skills are developed as they begin to integrate with other children. So their conversations develop, their social skills are developing, their cognitive skills are developing. Without those skills, our children are being left behind in that particular aspect, and they lose their ability to be able to communicate on an effective level and be able to express themselves, because they will not know how to do that because of that low level of understanding amongst themselves and other of their mates within the class.
Thank you. President Steele?
Thank you. Well, first, I agree with what was stated. The pandemic was basically hard on all of us and everybody. No matter what you were doing, I think it affected all of us in a different way, whether you were still going to work all the time and basically isolated at work, or whether you were staying home and removed from your community and stuck with, telecommuting from work at home, or whether you were laid off and at home. It affected all of us. But one thing I take away, or I hope we take away in the future, as far as lessons learned and how it relates to lessons learned from the mental health area, is one thing I noticed is we saw home visits being normalized, where more people were having home visits, and we saw pop-up service areas kind of increasing as well. I think that's just as important for us to see moving forward for mental health. We need more mental health home visits and more pop-up clinics available for someone to stop in to have their mental health issues addressed. So I hope we can see that moving forward with the pandemic. But also I wanted to mention, at MWRD, we did have a speaker from the district's employee assistance program, and you can find that information on our website. And they address some mental health issues as well and how you could deal with that. So after this, maybe, in a couple of days, visit our website and check out that district's employee assistance program as well.
Thank you, Commissioner Steele. Commissioner Buclet?
Thank you, Commissioner Vice President McGowan. So from my perspective, I would say mental health is probably the most neglected areas of health, both locally here in our area and also globally. This was true before the pandemic, but the pandemic just made it even more obvious. we need to put more resources into funding mental health programs. I think mental health has been ignored because mental health services were mainly focused on psychiatric hospitals as opposed to preventative mental health services and counseling. The COVID crisis has exposed the vulnerabilities of our health systems globally and again here locally. So for health systems to achieve sustainability, strong primary health care, I believe, is essential, which would include mental health services. Primary healthcare services can only be considered strong if they address all components of healthcare, which would be physical and mental. Therefore, mental health services must be integrated into our overall health system as opposed to only being provided in a silo. So finally, simply put, there really is no health without mental health.
Okay. Thank you, Commissioner Buclet. Commissioner Perry.
Thank you, Vice President. I think I'll answer this from like a Black student perspective. There was a lot of stressors that Black students had to navigate during the pandemic. An example of like a financial stressor is like students depending on campus-based jobs to pay their tuition and other school fees. But those jobs being eliminated during the lockdown and during social distancing, or how like students had to depend on dormitories to provide stable housing or campus meals to guarantee them to have a meal every day. But when you're told like you have to return home to your mom or dad or grandma, and you have no steady stream of income, that takes a toll on your mental health. And on top of like working through the pandemic, having to deal with racial violence throughout the United States, and just feeling the pressure to have to contribute to the movement in some type of way. I've just kind of watched just like Black students have to just deal with a lot of these issues intersectionally. And we've just watched how more online mental health services like Therapy for Black Girls or freeblackTherapy.org have emerged. And we just have a high demand for therapists that look like us, who can understand that intersectional nature of our stress. But the pandemic has only shown that the underfunding of mental health services at the high school level, college level, community-based level has created a situation where there's more demand for services than there are therapists, and we need to fix that.
Thank you, Commissioner Perry. Alderman Taliaferro.
Thank you, Commissioner. I love the way you say my name. You know, Commissioner, you mentioned at the onset of the question, you know, the impact of the Tuskegee experiment.
Right.
And I think that has had a very significant role in why we see a lot of folks in our community not pushing to get vaccinated. I'm fortunate enough to have some type of comparative data or comparative study because I represent 60639, which is predominantly Hispanic and African American, 60644 and 60651, which are predominantly African American wards. But I also represent 60707 and 60634, which are predominantly white wards. And there is a huge disparity in the number of people that are vaccinated and the number of people that have caught COVID. And one of the things, there's so many different factors we could attribute to that, but one of the factors I certainly believe that should be attributed why we have that lack of trust is when we look at things from a historical perspective, like the Tuskegee experiment. We have grown to distrust government from the police department on down, and that includes CDPH or healthcare providers. Disinvestment in our communities have led to it, lack of resources that pour out. And then when we get those resources, oftentimes they're subpar and don't have the quality of services that you may see in another community. But I won't talk about all that, but what I will say is that's one of the underlying factors, as I see them, which promotes a lot of our residents not willing and not wanting to trust the government to say that this shot that you're giving me is going to help me and protect me from the COVID virus. In fact, many of them said, I'll do it myself. I'll wear my mask and I'll stay inside but I won't get that virus, that shot because I don't trust the one that's providing it to me. So there's so many factors, Commissioner, but I would certainly attribute the historical mistreatment and lack of investment in our communities.
Thank you, Alderman Taliaferro. So
Thank
far, you're the only one that's gotten the buzzer. But thank you so much.
I'm going to start keeping track.
Okay, regarding the healthy diet, the cost of groceries has skyrocketed during the pandemic. This has a direct impact on what people are able to purchase. And now we got Russia that is doing whatever they're doing over there, and they're telling us that the prices are going to go up even higher. What are the alternatives to providing and maintaining an affordable, healthy diet? And let's start with President Steele. Then President Buclet, Commissioner Buclet, Commissioner Perry, Alderman Taliaferro, and Dr. Lockhart.
Thank you, Vice President. I would say some alternatives are to lean on your elected officials and your community organizations in your area. So I realized during the pandemic, there was an increase of food drives that were available, that were giving out healthy alternatives to food all the time. Like churches really picked it up, community groups picked it up. And I know because one, I assisted with a lot of those giveaways, but also spreading the information. So I would say start with contacting your church, contacting your elected officials. Even if you don't call the office, connect with them via social media or visit their websites. And they're always posting and sharing information about various food giveaways where they're providing you with groceries that can at least last you a couple of days, and healthy options, fruits and vegetables. So I would say start with that. I always try to share the information. So don't think that you have to contact your alderman or it has to be your state rep. I would say anyone involved with your community probably has their ear to the street and they're hearing about options for food giveaways, and they'll be willing to share the information. So don't be afraid to ask and step out there. And that has been the best alternative that I've heard about as far as getting you through this time where, you know, money is short because prices are going up, but there's help out there. You just have to look for it and ask.
Thank you, President Steele. Commissioner Buclet.
Thank you, Madam Vice President. So to add some statistics to the question, the number of households, particularly Black households, has increased to 16% not having enough to eat in the last week, compared to 6% of white households. That's a serious increase, and it's gotten even worse during the pandemic. Some of the policy recommendations that I would make would be to make it easier to get the EBT cards, which is a way to get groceries, you know, with money from the government. Also, there are very few, if any, farmers markets in minority neighborhoods. We need to rally around with our elected officials and community organizations to have more community gardens, or farmers markets rather, in our neighborhoods, because farmers markets generally have much less expensive prices than the regular grocery stores, and it's locally grown, so you're supporting the local economy and you're getting more groceries and more bang for your buck. I would also encourage our communities, if at all possible, to do more community gardens. There are lots of community gardens around the city that grow the vegetables and the fruits, and they're giving the food away, to President Steele's point, at food pantries and at churches and at elected officials' offices. So if we can get more community gardens, if we could get more farmers markets, and if we can just find a way to conserve some of these resources and getting the government to possibly give more money for EBT cards for food, I think that might be helpful to some folks that are having trouble putting groceries on their table.
Thank you, Commissioner Buclet. Commissioner Perry.
Thank you. I think President Steele and Commissioner Buclet kind of alluded to what I was going to say. I mean, I want to shout out two things going on in Inglewood. So Dion Chicago Dream is a nonprofit that's tackling food insecurity in Inglewood. So very similar to what President Steele said, just there are nonprofit organizations doing the work that are either providing community fridges that you can go to the fridge, grab what you need, some food pantries, as well as like food deliveries right to your doorstep. So just really being, like diligent about that, like finding those organizations that's doing it. But in addition to that, just really advocating for like more grocery stores in our communities. Like there are still areas that have food deserts. Some places only have one grocery store for the whole area. I know Inglewood again is welcoming a new grocery store sometime in March called Go Green, and it's all locally sourced food. So just really just being, staying on top of our elected officials to tackle those things, because every community should have access to fresh produce and groceries. So I think those are the two things I'll add.
Thank you, Commissioner Perry. Alderman Taliaferro.
Thank you, Commissioner. And I will be brief this time because the esteemed panelists certainly said everything that I would have said as well. But I will add this, if I may. We are probably for the foreseeable future looking at a conflict that's going to last an extended period of time between Russia and Ukraine, and especially with the Chinese deciding to support Russia's efforts. And so we do have to look more so toward the future as well. And I would even add to the great things that have already been added is that we can also reduce the cost of our own expenses by creating our own gardens in our yards, whether they produce herbs or vegetable and fruit. Those are just some alternatives, I think, that would help reduce our bill as the prices continue to skyrocket. And I look at the Super Bowl timeframe where the prices just, my buffalo wings were 3 times the cost. And so, I was a little upset. So, but I would add those into, looking at the great examples that were given before that can come out, like the Chicago Food Depository and the other organizations that help out. Time.
Thank you, Alderman. Dr. Lockhart.
Commissioner, thank you. Everyone has spoken so well and given so much information in regards to what we can do as alternatives. But the only thing that I would add is that for me, there is no alternative to a healthy diet. It's like either you do or you don't. And so the only thing that I could really relate to would be making better choices. So making better choices would be, where do I shop? Who has the best sale for what I have? Or attending, as some has already spoken, finding those farmers market and finding where there are food pantries in your area that you could visit. So, and also, as one I've already talked about, working with where you can get additional fund for money to purchase food and not being wasteful of food. So in order to make things, to keep things affordable, and a healthy diet is really about making the best choices. How do I spend? Where do I spend? How I get these resources? So I'm making the right choices. I think it's the best way that we can continue to have a healthy diet. I know we have a food pantry where we serve hundreds of people all of the time. And so even them making choices about what I get from the pantry, they're not always healthy choices, but we have to encourage them to make the healthy choices so they can keep their immune system built and be able to fight off a lot of things that come our way in our community. Thank you.
Thank you, Dr. Lockhart. Hospital availability. There's a lack of choice of hospitals in the Black community. In addition, there are structural and systematic inequities that have existed in the healthcare system for centuries. These inequities include access to healthcare, as previously mentioned, and health insurance, in addition to lack of diversity in available healthcare professionals. How can we change this? I'd like to hear from Commissioner Buclet first, then Commissioner Perry, Alderman Taliaferro, Dr. Lockhart, and President Steele.
Once again, thank you, Vice President McGowan.
Okay.
Yeah, historically, there have been huge disparities in healthcare for African Americans. One of the things I know that the state of Illinois has done to address the healthcare disparity is to pass legislation that provided $150 million in state Medicaid money over the next 7 years to fund new and innovative community programs that are aimed to help improve healthcare and Medicare in the neediest of neighborhoods in Chicago, mostly underserved the Black and brown communities, and of course, these communities have been hit hardest by COVID-19. An example of this is the Southside Health Transformation Project, otherwise known as Sshtp. This program was awarded state funds, and these funds will be for the hiring of additional primary care physicians and hundreds of community healthcare workers, which will increase access to specialists, build community partnerships around social determinants like health food and access to food and transportation. So additional programs like this, in my mind, are an example of how we can start to fix some of the inequities. And I think I read a statistic recently that said that the incoming class of medical students had the most African-American, Black and brown students that it ever had. So I think if we just keep recruiting and trying to get more African-Americans into medical school so that they can come into our communities, that's another way that might help some of these disparities.
Thank you, Commissioner Ducla. Were you finished?
I was gonna say, I hope that wasn't over 2 minutes.
Oh, no, you would have heard it. I would have let you know.
Okay.
No, you did. You did great. Commissioner Perry.
For sure. I think I'll tackle this from like a Black maternal health perspective. So I just think about how like Black women are more likely to experience complications or even die from pregnancy or childbirth compared to any other race. And just thinking about like how COVID-19 has really exacerbated that, like those social distancing guidelines, like any person that's like an advocate for Black women in labor, whether it's a doula or a loved one, those were limited. And doulas were often not even allowed in the room in the first place. So I just think about how that's affected like the quality of pre and postnatal care for Black women. And so when I think about all of these different organizations and the different legislation that could be passed to improve those complications, because like Black women have often been like undermined or like their pain has been reduced. So there's legislation about more patient-centered care, expanding paid family leave, of course, expanding access to healthcare insurance, but also just like forcing hospitals to really update like what their best practices look like, because Black women in particular aren't often weren't considered when those best practices were drafted. So just really doing a complete overhaul to make sure that the patients are like treated as the experts and not the other way around.
Thank you, Commissioner Perry. Alderman Taliaferro.
Thank you, Commissioner.
Sure.
I think some of the things that we as elected officials can really focus on, and I say this given if you look back at the last presidential administration, that administration started with a clear attack on healthcare that's especially being provided in minority communities. In fact, the administration spent the entire first 2 years trying to attack Obamacare, which was a plan to make healthcare more affordable and more convenient in the Black and brown communities. And this administration spent almost 2 years, even going all the way up to the Supreme Court to dismantle healthcare. So I think we as Black elected officials have to make sure that is always on the top of our priority. And that's to make sure our residents are receiving quality and affordable healthcare. And one of the things we could do is really invite organizations like Oak Street Health, which are on-site clinics and quality on-site clinics in our communities. And we had to promote and I would say even encourage workforce healthcare programs. I know the city of Chicago has promoted a program for the last 10 years or so that says, hey, every single individual employee of the city have to enroll in this online healthcare screening, healthcare training, to better improve their health. It keeps prices down, it keeps doctor visits down, but it improves healthcare. So I think we have to support those initiatives as elected officials to make sure that our residents are continue to receive quality and affordable healthcare. Thank you, Commissioner.
You're welcome, Alderman. Dr. Lockhart.
Thank you, Commissioner. I am in total agreement with what I've heard, but I want to speak to one of the things that Alderman Taliaferro has mentioned, and that has been one of my pet peeves, is that the way we can really be active is to make sure that legislation is changed. You know, it happens at that level, and to hold as a non-elected official on this call, as to hold our elected officials accountable for the choices that we made. We need to say to them what we're lacking, and they need to be concerned enough about their constituents, about the community, to say this is what we need. So the way I see it as being a community organization and making sure that happens is working to get legislation changed. And that's the only way that's going to happen. You know, is that has to change. And so again, holding them accountable, making sure we hold them accountable, our elected officials accountable, but making sure that the laws are in place and legislation is in place to make sure that we receive the quality of healthcare that we need, speaking up for us and making sure our voices, their voice represents our voice. Thank you.
Thank you, Dr. Lockhart. President Steele.
Thank you. And of course, I agree with everything stated. I can just almost put a bow on this by saying, yes, I agree. We all should work together to hold what we need accountable in our system, to make sure we have quality healthcare in our communities, but support our elected officials while we're holding them accountable. So we know there's strength in numbers when we have an elected official that's fighting for, say, a hospital to stay open in the community. Everyone needs to show up to support that elected official. Absolutely. Make the calls, write the letters, and show up in whatever way you can, even if you don't have time to go to the press conference, make a call, write a letter, but in some way, make sure everyone knows that it's important for us to have quality healthcare in that community. And also, like we're doing now, talking about healthcare, we should talk more about preventative healthcare, to make that a normal conversation, just like we're doing now. Just keep talking about it so that then maybe we can avoid some of the chronic illnesses that are, you know, hurting our communities.
Thank you, President Steele. Commissioner Buclet.
I think I answered first.
Did you?
I think so.
Oh, okay. I'm sorry. Well, let's talk about healthcare providers. Diagnostic decisions can be influenced by a patient's race and ethnicity. What is needed to change the mindset of doctors when they are diagnosing or treating Black patients? I'd like Commissioner Perry to start, please.
Absolutely. First off, I think Commissioner Buclet mentioned this before, like we need more Black doctors in general, but that's also not the underlying issue. I think the underlying issue is, you know, we don't treat patients as experts. So when folks go to the doctor and say they're in pain, Black folks are often undertreated for pain. We're often told that it's not as serious as it is, and we know our bodies. So actually, like, training medical professionals to, one, reduce their bias about this idea of our pain tolerance, but also when they're going through medical school, actually teaching them about social determinants of health, teaching them about intersectionality, understanding environmental factors and other community-based factors that really contribute to some of the health disparities that we have. So I think creating a better trained workforce, medical workforce, I think is important. And I think in addition to that, you know, funding our local community-based clinics more, because they have an ear to the ground. They know they have some people who frequent those clinics often, and they just have a better understanding of what the needs are in those communities. So from a funding perspective, from a local side, but also making sure our doctors are well equipped to deal with an array of individuals and not using like a one size fits all model.
Thank you, Commissioner Perry. Alderman Taliaferro.
And I certainly agree with Commissioner Perry, especially, and I think this is probably one of the more primary focuses that we need to look on, and then that's having more doctors that represent or that looks like the community in which the hospital sits. But you know, we always deal and always have dealt with the reputation of the quality of hospitals in Black and brown communities, particularly in Black communities. You know, I have one in mind that have suffered from one crisis after another, which lends to a reputation. And that reputation, when it's bad, it can lead to a doctor not performing well or even wanting to perform well. And so one of the things that I think we should be able to do is be able to have to ensure that there is a continuous evaluation of those specific doctors. And let it be public. I know that there are databases and websites that we can all go on and to look at the quality of services that's being provided by that particular physician. But it needs to be standardized and it needs to be legislated, because it's very difficult and to overcome a hurdle of providing providing poor services. And therefore you get those that are in that particular area in which it serves that want to go elsewhere. So on top of what Commissioner Perry said, I would say, you know, we need a better evaluation system of the doctors that are serving in the hospitals in minority communities.
Thank you, Alderman.
Thank
Dr. Lockhart.
Thank you, Commissioner. I agree with Alderman and Commissioner Perry. And I just wanted to add to that is that one of the pet peeves that I always think about is education awareness. Doctors being educated on how to communicate with our Black culture, and not just communicate, also to listen. That's very, very important, that they listen to what we're saying. And they need to be, you know, everybody is not a good listener. They may need to be trained on how to listen, because just hearing what I'm saying is one thing, but if you are listening to me, that means that you're responding to what you're hearing me say. And so I think in that way, Commissioner, to treat Black patients is that they need to be trained better how to be good listeners, listen to what we're saying. In some areas, make their cultural awareness. I agree with the social determinant, but that cultural awareness on how we do and what we do and the way we respond is very important. And not just to just give us medication to get us out the office, but to listen to us and be able to provide what we needed based on what we're saying, because it is true. We do know our bodies and we do know how we're feeling. Sometimes we don't have the answer, but if you listen, you'll help us discover the answer to our problems. Thank you.
Thank you, Dr. Lockhart. President Steele and then Commissioner Buclet.
Thank you. Well, first, I agree with everything stated. What I would like to see is, one, we encourage our children to go into the healthcare profession. We need, of course, as was stated, more Black doctors and people just in the medical field. Also, when doctors are, when you're in med school or learning to become a doctor, there needs to be more diversity as far as just the learning program. Simple things like pictures to maybe visually detect an illness. Sometimes textbooks might only have an example on Caucasian skin, where you know you need to see examples for different ethnicities so that you can identify what's going on. Also, for when doctors are completing their residency, it should be required that they have to deal with a diverse group of patients so that they can be able to, once again, diagnose people of different races and also be able to relate to them. But until then, until we see more diversity, we have to be our own advocate. We have to really advocate for our own healthcare. That means keeping a list of your questions and your symptoms before you go to the doctor, so you won't forget. But when you get there, ask those important questions and ask that doctor to send you a follow-up of the medications he's prescribed or he or she has prescribed, and maybe what your treatment should be, just so that you can also have a paper trail. But you might need to get a second opinion if possible. And don't hesitate if you feel your doctor is not, addressing your concerns. If you think it's racial, and don't second guess yourself and say it's all in your head. It's okay to change doctors and get a second opinion.
Thank you, President Steele. Commissioner Buclet?
Thank you. I'm going to agree with everything the panelists have said. I think what I'll add to that is, I think doctors, not all doctors, some doctors kind of have this syndrome where they think that they're like godlike, and so they don't feel the need to listen to us or to patients because they feel like they know everything. I think it's even worse with the African American community, because we don't always speak the same way as the doctor may speak, and so they may look down on us because we speak a certain way. We don't speak like them, which is completely inappropriate and completely wrong. But we all know that happens. So if there could be some training of understanding of cultural differences, and also the fact that an African-American person and a white person may have the same disease, but because of our environment, because of our background, it cannot be treated the same. So they need to be educated on, I think, our history and what we're going through at home to diagnose and treat us differently than they may a white counterpart. Again, some doctors can be dismissive. To my colleague's point formerly, that if you don't feel comfortable with the physician, or you're getting a bad feeling, it could be racial, it could be not racial, whatever the case, find someone that listens to you, come prepared, and be willing to change doctors if you're not comfortable with what they're saying. And then my final point is what we've all been saying, is we just also need more African-American doctors in the system.
Thank you, Commissioner. This is an open question. I'd like all of you to share your thoughts on what we can do right now, to correct the disparities of what we've discussed regarding Black health and wellness for African Americans, starting with Alderman Taliaferro.
Commissioner, I think we have to first start off with what we have. If what we have is not providing what we should be receiving in the Black community, then we absolutely have to demand better from them, because that's where the disparity begins. Yes, it could be argued that the disparity begins when you actually provide the service, but I think one of the most important things that we can look at is the quality of service that's being rendered to those living in the Black community. And so I think we have to start with that. Challenge those that are providing services to provide better service, and to provide more services as well. And so I think that's the first look we have to do. If we're going to look at, what might be provided in the white community as compared to what might be provided in the Black community, we got to start with those that are providing those services and challenge them.
I'm going to ask another question here. Based on something Dr. Lockhart said, that we need to have doctors that listen to us. But don't you think that we need to take some responsibilities when we walk into a doctor's office and he tells us that this is wrong, when our body is telling us, no, that's not right, something is wrong? Don't we need to stand up and ask more questions ourselves? Because I've experienced going into a doctor's office, my foot was hurting and I was limping. So I went into the doctor's office and he looked at my foot and said, "You have arthritis." And I said, "No, I don't." So he looked at me and said, "Well, okay, we'll take an x-ray." I had a broken bone in my foot. But had I just said, okay, he would have gave me some arthritis medication, I would have still been hopping when I walk. And that's why I say you know, it was said earlier that we should know our bodies, and we should. So had I not agreed with him and knew better, I probably would have walked out and been taking arthritis medication, but I really didn't need it. So I think part of this lies on us too. We need to ask questions and at times not always agree. We're the people that doctors say always have high blood pressure. We're diabetics, we this, we that. So it's a common thing that when we go into a doctor's office, they sometimes don't take the time that they should, give us the test that they should, you know, to find out exactly what's wrong with us. So it is important that we know our bodies, ask questions, and not think that the doctor that we're talking to is God, for lack of a better word. I know I'm not supposed to do that, but I just wanted to put that out there. Dr. Lockhart? Okay, your mouth is moving, but we can't hear you.
So I want to be clear that the question is, should we be more verbal and communicate about our own and take responsibility, right?
We want to know what we can do right now.
Okay, so I got you. I thought you interjected something else.
No,
yes.
No, that is something that we can do right now. That is to ask more questions.
Absolutely, absolutely. I agree. And what I wanted to say is that we have to open our mouth.
Right.
We have to say something and not just accept what our doctors are saying, because all of the times they're just reacting sometimes on what we're saying to move us about quickly. And then we have to hold them accountable for what they are sharing with us, what they are telling us. We have to hold them accountable. We have to be very proactive in that particular way. And the main thing that I say is that we have to say something. You know, we have to be reactionary we have to react to stuff. We are reactionary people. Let me get that right. We react to many things instead of being proactive. So we talk about it, but we don't do anything about it. So we have to start being proactive in our process on how we relate to our medical profession, on how we relate to each other, on how we relate to the community, instead of, okay, we all have stories to tell. We can talk about it, but if you don't do anything about it, the problem still exists. So we have to be proactive in that process, making sure that we are asking questions, that we are sharing, and that we are telling others what it is that we need to do instead of not speaking at all.
Okay. President Steele?
I agree with what has been stated about what we can do right now, seeking up. I would also say to support the elected officials or community organizations that are making decisions in your healthcare services in your community. Support those groups, attend the meetings, also have conversations with your healthcare provider. Usually there are support groups or some type of groups associated with that actual healthcare facility or hospital. Start attending those meetings and talking to them. Also start open those lines of communication, not just when you're in the doctor's office, but outside in the community, to try to just knock down these walls of disparity that we are seeing. So definitely open your mouth, join community groups, and support people who are making the decisions about your health care.
Thank you. Commissioner Buclet and Commissioner Perry.
Thank you. I agree with what everyone on this panel has stated, particularly being proactive and taking control of your own health care. And to me, being proactive means to try and eat as healthy as you can, less salt, less fat, more whole grains, more whole foods. That doesn't mean shopping at Whole Foods, because I know that can be expensive, but there are things you can get other places to help you be more healthy. Exercise more, move more. If you're driving to the store, park far away from the door and walk further. So instead of circling, trying to get the closest spot available. I'd also will say for us to take control is to push all of us to get vaccinated. If more of us get vaccinated, and we can stop this pandemic as best we can. And some of the comorbidities that some of us have will make it less likely that we'll get sick and then, be hospitalized with this disease. So eating healthy, exercising more, getting vaccinated, and being proactive are the things that I would suggest.
Thank you. Commissioner Perry?
Absolutely. Just reiterating, I think a lot of this has been stated, but just really taking advantage of those free resources at our disposal. Yes, we can't always afford everything, but there are some free things, like there are some free online therapy services. There are free blood pressure checks that are in our communities. There are free sexual health resources are in our community. So just really taking advantage of those. That's what they're there for, and not feeling embarrassed or fearful about taking your own health in your own hands. So I think I'll end that with that.
Okay, thank you very much.
Commissioner, can I just add one more thing? And
Of course you can, Alderman. Go right ahead.
Your response earlier and then the response to the panelists really had me thinking about even my own personal thoughts. Because I fall into that stereotype of Black men that don't typically go to the doctor. Or, I mean, there was a time when I would get a physical every single year without fail. And over the last 5 years or so, that's tapered off. But that is a stereotype of Black men that we would rather not know, and we don't go to the doctor. So I think that educational piece for Black men particularly have to be something that we really think about, because we die much earlier than than Black women, and women typically will take care of themselves much better than Black men. And so if we can tackle that stereotype of Black men not wanting to know and not going to doctors, we can serve our community much better.
Anyone else have anything they want to add or say, or? No, you don't. Okay. Well, thank you so much. In conclusion, I'd like to say that this has been an excellent discussion. I appreciate all of you for your thoughts. This is a conversation that needs to continue throughout the year and not just during 1 month. So I want to thank the panelists. I want to thank the guests. I especially want to thank all of MWRD employees. You guys are great. Thank you so much for tuning in. I want to give a special shout out to Committeeman Calvin Jordan, Leandria Sanders, Commissioner Mariana Sparopoulos, Infrastructure Engineering. We've just had so many people to tune in, and we appreciate it. I think one of the things that we need to do is reach out to each other a little more. Let your next door neighbor know that, you know what you cook today, because I ain't got no food. There's nothing wrong with, with doing stuff like that. We do it where I live. I might get home at 6 o'clock and call my neighbor and say, well, did you cook today? So let's do that, in our communities. Let's do that with our neighbors. And if we do that, nobody has to go hungry. They really don't. So once again, thank you. Later on this year, I'm going to be looking forward to celebrating Juneteenth with all of you. We're hosting a celebration at our Stickney plant in Cicero, and we'll be sending you more details. We are good. We are on time. Thank you so much for giving us this hour. We really appreciate all of you, and may God continue to bless you and keep you safe.
And Vice President McGowan, we thank you. Thank you for leading this conversation. We appreciate you.
Absolutely.
Well done. Thank you so much. Thank you.
Very good. Very good. Thank you.